Okay, so we are ready. Can you confirm I have Helena and Udemy on the call? You can unmute your mic.
Udemy on the call.
Welcome, Udemy. What about Helena?
Yes, I'm also on. So
thank you very much. Abigail is here as well. Okay. Okay, so we are starting now with and I'll be introducing the moderators. Then Abigail, if you can stream the AGGS panel document for this session. I'll appreciate it. The speaker's bio so that I can read out the moderators' bios. Okay, so I'll hand over to Abigail Odishika Ado to introduce the moderators, and then we move to the next, we move on with the session. Thank you very much. Abigail, over to you.
Hello, good morning, everybody. Thank you for coming on the session. So today we have Udemy Okono as one of our moderators. Udemy is a psychotherapist with 10 years experience dedicated to mental well-being and growth, personal growth. He's a celebrated conference speaker and event facilitator. He has been guest speaker at several high-profile conferences and trainings, some of which were put together by Global Shapers Community, Microsoft Nigeria, African Novice Nurses and Students Initiative, among others. He offers psychotherapy sessions and general psychological support to clients spanning Africa, Asia, and Europe. He is the founder of Teletherapy Nigeria and the co-convener of the Sacrificial Lamb, an annual exhibition of arts to create awareness and raise support for mental health in Akwa Ibom State, Nigeria. He has been the forefront of suicide awareness, prevention, rescue, and rehabilitation in Akwa Ibom State, an effort that has over the years recorded successful rescue and rehabilitation of 8 attempted suicide victims between 2018 to 2023, and has trained 83 para-counselors to serve as first responders to suicide cases. He is the curator of the Global Shapers Community Uyo Hub. Udemy, thank you for coming on and welcome to the session.
Many thanks for having me on the show.
We also have Helena. Helena, I'm sorry, I don't want to murder your surname, but I'm going to try. Helena Johannes. Helena is a public relations professional who is passionate about youth development and community education. She has a degree in journalism and media technology with a major in public relations from Namibia University of Science and Technology. She is a part of the Women Going Digital cohort of 2023. Helena is the head of the Global Shapers Windhoek Hub communications team and has strong interest in media law, technology, digitalization, and computation. So Helena, thank you for coming on. And I'll hand over to yourself and Udemy to introduce our speakers.
All right, many thanks for having us once again. Helena, are you ready for us? Okay, awesome. Can we please have a list bio so we can run through the approach? Thank you. Okay, so there is a shielding pop-up window by the side, by your right. I think you should exit it before I talk about. Okay, so this is Joshua Alade. Joshua Alade is an education and decent work policy advocate, made about positive youth development and sustainable community development. He is the executive director of NG Youth SDGs, Network of Youth for Sustainable Initiative, youth-led civil society organization advocating for meaningful youth engagement in policies and programs that enable them to lead and thrive. Joshua has a master's in sustainable development from the University of Bradford, Scholarship Award, Over the last 6 years, Joshua has invested in youth development and activism to improve access to education and decent work opportunities for young Nigerians and underrepresented youth. His work focuses on cultural authenticity and youth leadership for sustainable development. Joshua was awarded the 2022 Young Pacesetter for African Development on Africa Day, United Nations. Please, let's make welcome Joshua. Helena, please, do us the honor of reading Honor Olapo Thomas's profile.
Yes, good morning, everybody. Thank you guys for having me here. So one of our speakers we have is Olapo Thomas. Olapo is a human resource professional with over 14 years experience. And before she joined the Film House Group as a chief people officer, she worked in a senior management roles across various sectors or industries, including financial services, retail, and hospitality, in which one of the big four accounting firms. And also she holds a BA and Master's in Economics and International Relations from the University of Aberdeen, and is a certified, and she is certified as a senior professional in human resources by the HRCI, Alexandria, Virginia. So she also has deep experience in the people or HR space, including organization structure, design and implementation, culture transformation, job evaluation, and also grading, and many others, including manufacturing, financial services, marketing, communications, oil and gas, education, health, aviation, and not-for-profits. So, Olapo, welcome to the panel discussion.
Good morning, everyone. Thank you very much for having me. I'm happy to be on the panel this morning.
Awesome, thank you. Thank you very much, Elena. Dr. Ronald Igbe is, I don't know if it is Igbe because Igbe sounds pretty much like an Akagom name, but I thought his middle name is Kelechi somewhere. So Dr. Ronald Igbe is the founder of MRI Medic, healthcare consulting and digital media outfit dedicated to helping health brands tell their stories in media. Ronald is an alumnus of Swansea University, University of Port-Harcourt, and Madonna University, where he earned his MSc Health Informatics, MSc Clinical Anatomy, MBBS degree, respectively. He currently works on the digital transformation space in the United Kingdom. Ronald is a digital health enthusiast and content creator with over 5 years experience in content creation and health information gained from offline and online campaigns. Let me also add that he runs a particular newsletter called Behind the Scenes with Dr. Ron, and I am a proud beneficiary. I read his a lot. Please help us make welcome Dr. Ron to join us. Helena, please, you take off from there.
Good morning, everybody. I'm happy to be on this panel today.
Okay, welcome, Dr. Ronald. So we are moving on to our next speaker. I apologize actually for mispronunciation for the name. So Tsenkofatso Konsitwa, sorry for that. I really apologize. So she is a social entrepreneur, passionate about youth development, diplomacy, ethical leadership, and justice for all. And she's the founder of the Big Sister Society, which has reached about 55 to 624 people since its establishment in March 2021. She's the Southern African Regional Students and Youth and Consortium Botswana Coordinator, Africa Middle East Leadership Project Fellow of 2023, 2023 ST Petersburg International Economic Forum Botswana, and also the SADC Youth representative and member of the South African BRICS Youth Association. So welcome, Ms. Tsenkofatso.
Thank you so much. Thank you so much, Madam MC. Thank you, everybody, and good morning.
Awesome. Welcome. The mood seems to be very electrifying, and there are tons of things we're going to learn. I mean, I can't wait to delve into the meat of the matter. We have Leonce D. Mana. I mean, I just that's well enough. Next panelist is an accomplished program management professional with clinical psychology, public health, and advocacy background. With extensive experience in cross-cultural mental health, Leonce has held leadership roles in prominent organizations in the USA and African countries. His expertise and dedication have made significant contributions, including publications on mental health, trauma-informed care, and advocacy. Leonce's strong academic background and commitment to making a positive impact make him a valuable asset in the program management, public health, and peace. A round of applause, if you can. Some digital round of applause for Leonce as he joins us for conversation this morning. Thank you, and thank you so much.
Thank you, Mr. Odeme.
Yeah, awesome. So we get into the meat of the matter. Today we're addressing mental health crisis, nurturing well-being, promoting digital civility, and the impact of social media on mental health. Basically, mental health or social media came and it has its very positive sides. We can all tell that we have benefited greatly from the use of social media, but on one end, there is a possibility for everything that has a positive side. Definitely, there are negatives to it. And so we have outlined our conversation would definitely revolve around digital well-being and screen time, would revolve around cyberbullying and online harassment, and then work-life balance and burnout. It is in the course of this conversation that we will discover if actually we have a mental health crisis in Nigeria and maybe by extension Africa. So let me hand over to Helena to dive in straight into the Helena.
Yes, so I'll welcome everybody once again. So I'll just give a short overview of our discussion today. So as we know, social media connects almost half of the entire global population. It also enables people to make their voices heard and build connections across the world in real time. So with the advent of social media and digital technology, so mental health care has taken a new turn, while these technologies offer new opportunities for the diagnosis, treatment, and prevention of mental health disorders. So they also pose significant risks for individuals and society in general. So in this session, we'll explore the potential of technology in both exacerbating and alleviating mental health challenges, emphasizing the importance of responsible and inclusive governance and frameworks to combat cyberbullying, promote digital civility, and protect individuals from the online harm. So I will actually start with Dr. Ronald as a doctor. So I would just like to understand, we all understand that the digital age actually promises much for improving the well-being of people and also the health in general. So along with this, it's critical that we ensure benefits are not outweighed by the emergence of new mental health problems related to the invention of technology into our daily lives. So I just want to understand, Dr. Ronald, so how can individuals strike a balance between technology use and maintaining good health in digital age?
All right, thank you very much for that question. Yeah, you're quite spot on. We live in digital age now, and everybody has a mobile phone. Everybody is connected on the internet. Everybody is on their phones 24/7. They're checking Twitter, they're checking TikTok, Snapchat, and all of that. They usually say it has permeated every aspect of our life. But again, even when we look at the upsides, we also consider the downsides too, of being so much on social media or digital platforms, right? So in terms of achieving a balance, it's important that people also understand what are downsides of being so much on social media. You talk about things like cyberbullying, where in Nigeria, you talk about dragging people online and all of that. You talk about people seeking social validation from people who they don't even know at all. You're looking for the likes, you're looking for the retweets, you're looking for comments and all of that. And when people don't get that, then you now talk about issues like anxiety, depression, and all of that. So in terms of achieving a balance, I think it's good for people to, one, understand why are these platforms there in the first place, really. So I think a clear understanding of why those platforms there helps people to understand, okay, I really don't need to be here all the time, 24/7 and all of that. Then you also need to understand, why are you there in the first place, right? Is it to look for information? Is it to pass information? Is it to educate people? Are you buying goods or services? So that distinction has to be key. For me, most times I'm there to, share information, whatever content I have, share it there, spend a few minutes looking at what are the trending topics I could use to, make the next content or whatever. And I'm out, for my normal 9 to 5 activities. So understanding why you're using social media or digital media platforms in the first place is very, very, very important in helping you achieve a balance. Then typically, we usually advise people, you don't need to spend all your time on social media. Have time chunks where you say, okay, from this time to this time, this is where I'm going to be on social media. Yeah, it's difficult because everybody, apart from social media, we all have other things we're doing on our phones. Maybe you're reading emails, maybe your Teams from your office is connected to your phones and all of that. So there are other activities that are actually happening in your phone. So there are social media blockers, or digital media blockers, apps that can help you, block out notifications from those apps so that it doesn't look as if all the time you're looking up for Twitter notifications and all of that. So that's very important. Then we also talk about things like your personal PCs or whatever. We know people, sign into your accounts too on their laptops, on their desktops too. That has its upsides and downsides. So if you're not able to manage that effectively, you find yourself shuttling in between maybe the work you're doing or checking for WhatsApp notifications or checking for Twitter notifications, pop-ups and all of that. So we usually advise, if you can't manage that effectively, don't even, sync all your devices, on your PCs and your desktop so that you manage your time effectively. Then it's also good to, have like-minded people who are on the same page you are. We're trying to moderate how we use social media or digital media platforms, people that can keep you accountable too. So I also have people like that because we work on different things, and so we try to keep each other accountable so that you're not spending productive time looking for people who really, in quotes, add value to whatever you're doing in your day-to-day activities. So I'll just pause for now. Thank you.
All right, thank you so much, Doctor. That actually shed light on how you can balance yourself in terms of digitalization, of using digital platforms, and also just understanding why you are actually using social media and why you are using the digital platforms. So moving on, we understand that spending more time on your screens actually, like when you turn around, so it is phones, tablets, even smartwatches nowadays. So many of us spend more about 8 hours or more on our screens. So I just wanted to understand from Leonce, what are the common mental health issues that are associated with excessive screen time and the age groups or demographics that are more susceptible, and how does excessive screen time and the digital media consumption impact our mental health, as we understand that most of us now, everything we do in our daily lives is actually on the digital platforms, be it work, be it social interaction. So you come from work, you work 5 to 8, and then all the time on your computer, and then you come back again at home, you are on your phone, interacting with your friends and so on. So how does that affect our mental health issues? Leon, sir.
Thank you so much for inviting me. Again, my name is Leon. I'm based in Washington, D.C. I'm really glad to be here on this platform. I want to just agree with what Dr. Rona just said. Especially social media, the people who design the social media platforms we have now have intentionally designed them to be addictive. So again, that's one thing I want to really emphasize, because they spend time and energy and brain to develop them in a way that they become addictive. So that's one thing I want to mention. So one thing is that to address that, you have to be intentional. You have to be intentional to address that. So talking about the impact of excessive social media use on mental health, there are really many things here. I'm going to say a few of them briefly, especially among the youth. You're going to see a lot of increased social comparison and self-esteem issues, where people tend to compare themselves. You will see someone in very bad financial situation, watching something on Twitter or Instagram, people flashing money, cars, and good clothes, and they start to compare themselves, saying that, hey, I'm 40 years old, I'm 30 years old, I don't have this kind of car, I don't have this kind of clothes, I don't have this kind of body, and they start to compare themselves, and when it becomes excessive, it can drive someone to real life threatening issues, like suicide, as many have mentioned, and I'm sure we have people here who are going to talk about suicide. So the negative impact on self-esteem and body image is one of the things that have been observed so far, and actually some governments have declared social media public health issue. Well, like I know the government of Japan and US is considering something like that. And I think this is where actually governments should be involved in really looking forward to regulating some of this. The second big concern for me is cyberbullying. Cyberbullying is a real thing. It's happening. It's not only a Western thing. It's happening in our homes, in Africa, in Asia, everywhere. Cyberbullying can be in different shapes, and it is very, very prevalent, especially for young people, let's say under 18, but really also for adults. So cyberbullying can also be devastating. It has driven people, young people especially, to suicide, nutrition disorders, and social withdrawals, where people would just cut themselves from social life. This is something also that has been observed. And then the third, people have observed is what they like to call FOMO, fear of missing out. So you're sitting in your home, doing something productive, and then you see something going on, like a party, like neighborhood. You say, oh, man, I'm missing out on these things, and you start to actually leave the productive thing you're doing to really think hard on how you can be involved in a lot of things happening around you. And most of the time, those things are not productive. So this is fear of missing out, comes with anxiety, which can drive people to anxiety disorders. Anxiety is normal, but when it becomes a disorder, then that's when it becomes concerning. So these are three things I can mention for now, but I can talk about more of this as we continue. Thank you.
All right, thank you so much, Beyonce. So I think you actually gave a good points in terms of social anxiety and also just the fear of missing out. So I mean, a lot of young people that are joining social media nowadays, they are comparing themselves with people in terms of what they own, and I mean, nobody shows their negative side on social media, and that's one thing that you need to know. And young people don't see that, so they just compare themselves even with people that they have found already in the industry of social media. So it's actually a good thing that you shed light on that. So I'll give over to my co.
Thank you, Helena. Thank you, Leon. Thank you, Ronald. Fantastic points made. You see, in this era of social media and technology, and he made a really salient point about social networks being created to addictive, and yes, so that we have discovered. And I mean, it's a marketing strategy for the field that you have to be addicted to come back, you know, patronage and all of that. So yes, that's the idea behind it. And so now to Joshua Alade, are there strategies that could be implemented to improve mental well-being and reduce the negative effect of maybe excessive screen time and the rest of it? I'd like you to speak elaborately on it.
Thank you so much, Odeme, and great input so far from Ronald and Lois. And I'd say just picking up is this way of asking ourselves, how do I first try to regulate my screen time itself? And there are some apps that really help in doing all of these things. If you use an iPhone, there's this pop-up you get every Monday that tells you how much of screen time that you've used, if it's gone up or down. And there are times when I see it and then I scream. I'm like, oh my God, I've used my phone for so long over the last week, and it helped me to be very mindful about how I use my mobile phone. And then there are the weeks whereby if I get in another week and it says, oh, your screen time was down for like an hour or two, I'm like, okay, I'm winning. And then this when it goes high. So like they are really very helpful. I know that there are some other technology tools that you could actually use, some that would actually help you block up all your social media. You can lock it up. So those are like very good things for people to try out. Another thing that I would suggest, because hey, social media, it can be very addictive, and the people who have it or who made it actually did it that way to ensure that you just stay there, you keep commenting, they'll keep asking what's on your mind, or tell you this special information has been tailored for you, and then you start feeling special and all of those things. And so another thing I would always strategy that can be used is trying to go on digital detox. I know it can be very difficult, and I remember back in the days I usually do this a lot when I was working with a private sector organization. I just go off social media, I concentrate on work alone, and then maybe I only have social media during the weekends. But I know it can be very difficult, especially when you're an entrepreneur and then you have to keep up with a lot of deadlines, find out what people are doing and the likes. But doing digital detox is really very important, staying away from social media, from what's happening online. And hey, you are not missing out on anything. You're actually helping yourself regroup. You're actually helping yourself stay grounded, and also reminding yourself that every good thing takes time. And another part would always be this for us, understanding the importance of social connections, going out to make friends, like not staying online on Facebook, on LinkedIn, all the people hailing you there. They are just doing that because you scroll up. There are times, and to be very frank, And there are times where I just scroll on my social media and I see somebody say congratulations, or I see a photo, I just like it or I love it. I'm not reading. And because I know that there are people who they would always come online to see their likes, and I feel, okay, let me contribute to this person's experience of saying, oh, I have 1,000 likes or 50 likes and they liked. So go out there, make meaningful connections. It's really very important. We're in this day whereby people don't want to go out, but it's in going out that you are able to build friendships. There are people I've met by going out, and these are the friendships that have lasted for so long. Another thing I would recommend would be for people to actually find ways whereby they can become more physically active. Physical activity can actually help us be able to douse the impact of social media, trying to go out there, trying to be on your phone every time. Hey, go out, do sports, play football, hang out, run. In fact, it's so easy now. I try to count my 5,000 steps now because it makes me happy. I know that I'm actually doing something for my body. Really very important. And then it's also I remember I visited an organization one time, and one of the things they tried to do was they had this space that was a technology-free zone. So if for their colleagues, for everyone who works in the organization, if you just want to relax, you just go into that room. No technology, it's a dark room. There's a bed, there's a chair, whatever you want to do, just do it, but no technology. And these strategies would actually help in ensuring that people are more mindful about how they use their social media. Thank you.
Thank you so much, Joshua. Fantastic way to put it to a pause, because I was coming with a question about tech people, tech hubs, and all of those kind of spaces, and how they handle addiction. And then you actually outrightly pointed out one of those strategies. Fantastic. Thank you so much. The next question will be going to Shego Faso. I mean, like, one of the things you would do for us is by the time you take up the microphone, you try to pronounce your name for us, so that going forward, we would not have to murder it so much. I mean, you could take just a few seconds to take a tutorial on how to pronounce your name, which would really help us. Thank you. Thank you. So we're looking at the role of parents, educators, and policymakers in promoting digital well-being and reduced screen time, you know, negative impacts and all of that on youths and generally young people. So what do you think are some of the, you know, the role, what role do parents, guardians, policymakers, government, what place do they have in this discourse? What can they do and how can they do it? Considering that this is actually a very complex situation. You can't completely freeze out people's devices. They are almost always going to be with them. So what roles are there? What can these people do differently to help us step on this crisis? Thank you.
All right. Good morning, everybody. Well, excuse me for provokingly hammering my name, but it spells as Serofazo, and I am currently based in Gaborone, Botswana, the Southern African region, which is SADC, of course. Maybe just to get off before with the matter at hand, maybe I should, because I'm a social entrepreneur, I should delve more into, you know, the numbers themselves. We see that ever since COVID-19 pandemic, certainly it has escalated mental health issues. And of course, we see that Botswana has been ranked as top of all countries in rape statistics at 92.93, over 100,000 people, you know, has been identified by the World Population Survey that there have been rape statistics. And of course, there was also patient killings, which is a total number of 12 murder cases, and which makes up to 140%. We also see that there is unemployment, which rates up to 24.72%, with over 50,000 young people graduating each year. And then there's also depression prevalence, which is between 28 and 35%. And over 67% of women in Botswana have experienced abuse, which is over double the global average. And then, of course, there's divorce, over between 43 and 46% for first timers, and over 4,000 divorce cases are being registered through Botswana court every year. So maybe you might be asking why I started off with all these numbers. I just want to make it well known to this room that, all these issues interlace, and, they one thing lead to another. And that is why, of course, we have mental health issues. And of course, that is why, all these things that happen online are happening right in our lives, right in practical means. So to the question that you brought, you asked me, how can parents, educators, and of course, policymakers help to mitigate cyber bullying, and of course, ensure that young people are monitored with the usage of their phones online. I think first of all, we need to educate ourselves. We need to educate ourselves because, the generation that was before now is different from the generation that is now. If you are in the southern region or SADC, I would say, we call them AMA 2Ks. Like the AMA 2Ks, that the vibrant generation, that the goals to do, like they do whatever they want, anytime, anyhow. So it's important that we educate ourselves, or should I say the older generation should educate themselves on how to, relate with these young people, and of course, also educate their children on the usage of, internet or their cell phones. And like someone already said, I work for Apple stores in Botswana, and we also have the inscription code, and of course where you are able to also give permission. Let's say if someone is trying to personalize or impersonate themselves as if they are yourself, you can give a way of saying, is like it can give verification code of some sort to say, are you the person who's trying to log into this thing, or are you the person who's posting this type of a thing? And then we also have to go for cybersecurity classes. We need to learn about phishing. We need to learn about malware. We need to learn about, all these instances. Like, for example, recently in Botswana, there's been a situation where, there was this money laundering thing where people were told to invest in a thing, and then only to find out that it was a scam and they've been scammed of that money. So it's important that, we daily learn and inform ourselves, on all these cybersecurity measures and cybersecurity, should I say, problems that might arise with us being online. And then I think we should also inform ourselves on, the legal.
Give you my address, give you my phone number. Actually, the thing is, because I've not been around, the people have been calling me.
I apologize for that. Please, whoever that is should mute his microphone.
Please, you can unmute yourself, the speakers. Yeah. Sorry about that.
All right. Okay, thank you. Thank you so much. So like I was saying, I think we should normalize therapy. We should normalize communication. We should normalize having open discussions with our young people, as parents, as educators and as policymakers. This would allow a space for us to be genuine, to be human, and of course, to be authentic in such a way that we'll be able to address matters that affect us, in an amicable manner. We should also teach ourselves and learn about the laws that are prevalent, or should I say, that are existing in our nations. For example, in Botswana, we have the Data Protection Act, and Section 20 of the same act, it talks about, on how...
Go ahead.
Oh, all right, looks like Mr. Radolf wants to take over my presentation. All right, yes. So like we need to inform ourselves on the laws that are existing in our nations, so that we are well informed with that regard. And then we can be able to have all these dialogues and conversation, taking it from what is legally existing in our constitutions and our legal provisions. Thank you so much.
Thank you so much, Sago Fatso. I mean, I made a great attempt from your tutorial. So yes, she started out reeling very, very alarming statistics, and I think she also presented progress report on the side. So fantastic effort. And then she ended by talking about the need to continuously improve our knowledge about these things, because if we are not well informed about how what these guys, what the youth, what people we are trying to assist are going through, and we may not be able to work out solutions that will benefit them. Thank you once again, Sagofat. So let me hand over to Helena. Helena, please take over from there. Thank you.
Well, thank you. Thank you so much. So, I mean, coming from Joshua, he just mentioned about how to make meaningful connections, which I actually agree strongly, because I mean, in the digital world, we have people who live with the validation of followers. So if you have, let me say, for example, Instagram, people actually go with, if you have 20,000 followers, then you are an influencer, or you are, however, what are you influencing exactly? Are you positively influencing? Are you negatively influencing? That's the question. I understand we are all influencers, but positively or negatively. And also, thank you so much, Sengo Fanso, for the insightful data that you provided. And one thing that actually I do, or let me say my family does when we meet, is that when you enter the house, you leave, when you go to visit the parents, so you leave your phone at the door. So you just have dinner, no phone, no whatever. So that's a good strategy that everybody can actually use, especially parents, so that we don't actually keep away with the traditional way of social interaction as well. So yeah, moving on, I would just like to, I'm actually diving into now the legal framework of it. So I wanted Leon Sages to maybe shed light on what are the ongoing research and future directions in the field of online mental health services, and also how can we continue to improve the regulatory frameworks, privacy considerations, and also effectiveness of these interventions.
Thank you so much. Thank you for the speakers for all those really inspiring information. One thing I would say before I dive into the question is there's what the people call the pastor's daughter syndrome, where, you know, someone will tell their daughter, don't go out, no boyfriend, you know, you're staying here. So the time they manage to go out, or the time they manage to, you know, get that boyfriend, they're going to try, you know, use their time, you know, to try to know everything you're trying to prevent them to. So about social media, really parents to not prevent their children to use social media, but to help them to use it responsibly and effectively. Actually, there are people who are using social media to learn new languages, to learn new skills, to educate themselves. So I think as a parent, you know, just continuing on what the previous presentation was, to support the children to use the social media effectively. In terms of regulations, they are actually some people who are starting to take action. For example, on regulating the consent, because there's a consent for every social media. You know, you have to be 13 years old or 17 years old. It depends. But sometimes, most of the time, that is not regulated and it's not implemented. So some government have been trying to regulate that in a way that parent can sign on as a kid, their young son or daughter, when they want to sign up. So the parent has to sign up as well to make sure that they know what's going on. They can also monitor what the kid or the adolescent is doing online. That's one thing. Also, it is important to know that there are people with bad intention on internet right there. So to make sure that it's not only the utilization of your time, but also there are people with bad intentions. There's human trafficking happening, there is scamming happening, and all those things have been associated with increase in suicide rates all over the different continents. So it is important to make sure that those things are monitored and regulated as well. In terms of mental health, there are now a whole new areas in psychology that are just addressing social media and internet use. It is being developed, but now they're actually psychologists who are just professionals or maybe certified to do social media detox. As someone mentioned, social media detox, it's a real mental health branch now, social media detox, because it has to take different stages as other detox. Because if someone is addicted on alcohol or drugs, you cannot just take it away. There are procedures, psychological procedures to go through detox. That means intentional and regulated decrease in the amount of intake on social media to the point where it becomes sanitary again, it becomes healthy again. So I think those are things that are being done. But when we talk about mental health, you have to remember that, especially on our continent in Africa, mental health itself, it's a taboo. People don't talk about mental health, other kind of mental health. So now talking about mental health related to social media, that's kind of the next stage. So we have first to talk about mental health in general, and then digital mental health, digital associated mental health after, because when you talk about mental health, seeking advice from a professional in mental health, it's still a taboo, it's still stigmatized. That's a very, very big challenge, because here where I live, I see people going to see a psychologist because they cannot go off social media. So I think that's a big step that we need to take, just to talk about mental health in general, and then address the social media part. There's one thing not related to mental health that I would like to talk about that we didn't mention a lot is social media activism. Now, because of different issues with our different governments, young people have been really involved in activism on social media, but we have seen that's a good thing, for example. But if it's not done responsibly in a secure way, actually government have gone their way to track people who are using social media for activism and sometimes harm them or put them in jail or really do bad things to them. So all those things that social media can be good for activism. But as you know, I mean, I see people from Nigeria here, you remember the SARS time where actually the government was going behind people using social media to do activism. So, and there are courses, there are trainings on how to use social media in a secure way to do activism. So those are things I would like to engage as well, because I've worked with activists on how to use social media and its impact. So I would say in brief that it is important to address digital misuse to make sure that people can use social media, but in a healthy way. Thank you.
All right, thank you so much, Leonce. So I mean, you and Senkofatso actually gave emphasis in terms of cyberbullying and also the online harassment and also the various vulnerable groups to these harassments, which I believe is teenage people and also just young people in general. So I just wanted to ask Ronald as well. So what policies and legal frameworks are in place to address cyberbullying and online harassment, and how effective have they been in curbing these issues? If you can just give us as well your level ideas on that.
Yeah, thank you very much for that question and for the speaker so far. So in terms of policies, legal frameworks, right? If you look at, let me use Nigeria for example now. The issue is not if these policies exist. The problem is usually implementation because we have a lot of policies everywhere, littered everywhere. So the issue is the people who made these policies, what is the implementation plan? How serious are they about implementing all of these policies and all of that? I think that's where the main issues are. And until you implement a policy and people begin to see, the effects of, breaking these rules or some of these things, I don't think people are going to take some of these things seriously. For example, people come on Twitter, talk whatever they like on Twitter, drag people or bully people, and nothing happens really. And when you dig in, you see there is actually something that says nobody should bully anybody online, or these are the ramifications, or this is bound to happen if you do this. But at the end of the day, nothing happens there. So I think the focus should be on how do we start implementing these things? I mean, how do we keep people accountable in terms of what they post on social media? Because like I teach social media to doctors and healthcare professionals. So most times I'm like, it's a very thin line being on social media and also being a professional, right? You have to be careful about some of the things you say or some of the tweets you post out there. And I use myself for example. There are some conversations I naturally don't even dabble into because I don't even want to get into that space. You just read whatever it is. I don't even like, I don't comment, I don't retweet or repost. You just read and move because you don't want to get into the nitty-gritty. Some people say, yeah, social media is a leveler, right? Because you have access to people on a natural day you wouldn't have access. But again, you don't know who is who. I usually refer to social media as an alternate universe. You don't know what is happening there. What's happening on social media is completely different from what's happening in real life. You could tweet something now, somebody says, okay, I'm going to carry this guy's matter on my head until we see it to the end of the day. So you really don't want to get into those positions. So most times I think users generally should understand, I mean, it's not a place for bullying people, or I think that also brings me back to the first point I made earlier, that why are you on social media? Am I here to look for information or to abuse people and all of that? So we should understand that these things have effect. Then at a lower level, I know there are companies who try to, well, again, this is a conversation about another day, monitor what their staff, post on social media. You have organizations that monitor what their people, and you see people, they fire staff because of, comments or inappropriate posts. Because again, some people will tell you that whatever I'm posting is not on behalf of my company or whatever. But again, working for a company and making some funny comments on social media, you are dragging your workplace into that conversation, whether you like it or not. So some organizations really frown at such things, and they don't hesitate to, give you the letter when they think you're going off limits in the type of comments you put out there. And I even know some that won't even allow you be on social media as long as there was a company I was trying to get into, and when I saw the policies they were in, I said, no, this one, you can't even be on social media if you're in that company, if you're working for them. So they really don't even want to give that space at all. But again, I was like, I mean, for my own personal life, I need to be on social media. So I had to wait and say, no, I can't go there. So these are small ways companies are trying to implement some of these policies, regulate bullying and all of that. But I mean, that conversation needs to be had at a higher level. When should we start implementing? How do we implement these policies so that we make the social media space, a very safe space for every user out there? I have colleagues who are afraid to come on social media to come and post or whatever. You say, why are you scared? They say they are afraid of dragging, there's a kind of comment to post now. Everybody jumps on the tweet or on Facebook, and I mean, we are all on social media. We've seen people that after they drag, in quotes, they land in the hospital, either they are attempting suicide or something happens. So that tells you it's not everybody that usually has that mental strength to, face the online mob if they actually comes for you. So we need to start talking about implementing those policies to make the social media space a very, safe place for, every user who wants to come on that space. Thank you.
All right, thank you so much, Ronald, for that insightful conversation. So I would just like to hand over to Jemmy so we can take it.
Okay, thank you. Thank you so much, Helena, and thank you, Dr. Ron. Right now, let me go all the way down to Onalapo Thomas. She has been there from the onset, listening to our conversations, and I'm sure she would have a few thoughts to share with us. But again, looking at mental health and proposed interventions in very many organizations, I want Onalapo to help us outline, look at these strategies. How effective have they been so far, considering the diverse nature of the social media platforms, the emerging markets, and the pluralistic nature of different workplaces? Now, let me share. In the past, for instance, taking Nigeria into context, you would have private sector guys, companies just driving their staff fast. But recently, I think about 2 years ago, I had information that even banks have started to create safe spaces to go take a nap and just take a break. So I want you to look at these interventions. How well so far, and what can be done to improve it, looking at these factors that I've mentioned, please. Onalapo, your microphone is muted. Please unmute yourself.
Okay, sorry, I was having troubles unmuting myself. It was telling me that the host was not allowing me to unmute. So yeah, thank you very much for that question. That's actually quite a loaded one. And I think that, when I think about how workplaces are thinking about the mental health interventions, there are a few things that come to my mind, right? So as an organization, I think that the first thing, that needs to happen is that you need to basically conduct a needs assessment. You need to determine the type of mental health interventions that your employees actually need, so that it's more targeted to what they require, and you're not just going with the general available options out there. This would also help the organization to know what sort of like the common mental health issues that persist within their organization. Because, so for example, imagine in a hospital, right? Compare the hospital to a fintech organization, the sort of mental health issues that will crop up amongst the employees may be different. So it doesn't really work if you just take like a run-of-the-mill solution and you want to deploy that. It also helps you to assess, what sort of support you require, that you require to implement these mental health initiatives. And it also gives you an idea as to the possible barriers. Do you have the sort of workforce whereby people are scared to like speak out, or where there's a bit of shame, where they feel like, they're unable to talk about these things? If you do like a comprehensive assessment, a needs assessment, then it helps you to really understand, what is prevalent and, the best ways to actually go about it. I think it's also very important as well to train your line managers so that they're able to recognize any signs of mental health distress. They're able to have, very nice and constructive conversations with the employees, basically to draw out as much as possible the issues that the employee may be facing, and for them to also know when to escalate. Because as a line manager, empathy is important. and showing strong leadership capabilities is important. And there are some level 1 issues that the line manager may be able to solve that does not require escalation, whilst there's some times when you do need to escalate the issue. So it's always good to train your line manager so that they basically figure out at what points they need to escalate, how to provide level 1 issues, and how to recognize when the mental health issues have actually gone beyond what they can handle. I know that a lot of organizations, depending on the size, also employ mental health professionals in the workplace, right? Maybe they may not be full-time, but they may come in maybe once a week or once a month or once every 2 weeks. And that gives the employees an opportunity to just basically schedule focus time with them, go in, have a conversation, book future sessions where required as well. And I think that as the world has become, more global, and as mental health has taken a front stage, I think that it's also important for HR and executive management to run periodic mental health campaigns. So it can be once a quarter, it can be, once every half year, but there's basically like a mental health campaign across the business. Most businesses, sometimes they would print a shirt, they would link it to the core values, they will raise awareness. Basically, this is really just to stigmatize mental health in the workplace. And of course, it's important to regularly evaluate the mental health solutions that you have, and figure out how you need to tweak it, to make it a little bit more effective. I think that for me, when I think of how we can ensure, basically how we can track the effectiveness and quality of mental health initiatives in the workplace, especially given the range of everything that's out there. There's apps, there's platforms, there's providers. You need to narrow it down so that it's not, you're not doing a one-size-fits-all solution, but you're tailoring it to your organization.
Thank you so much, Lapo. Yeah, I think I got that now. Now over to Sagu Fatsu. Cyberbullying is a big deal. I mean, we've spent some time outlining some aspects of it, but you are a social entrepreneur, and maybe let's say that you are interested in social issues and resolving them. Are there innovative ways? What do we call them now? These organizations, what are private individuals, activists, and people like you, social entrepreneurs, doing to see how we can have safer spaces on the internet, on social media, and how to mitigate these cases of cyberbullying? What strategies are there? What technological advancements, what solutions are there on ground that are tailored towards reducing the impact, or even first of all, the presence of cyberbullying, and two, the impact on the users, please? What's down there? Sago Fadzo, please unmute yourself.
You can unmute yourself, Shannon.
Okay, thank you. What are the innovative technologies that social entrepreneurs are using? I would speak for my organization, which is the Big Sister Society. I started the Big Sister Society in March 2021 after the COVID-19 hit. And of course, we were, all the raid numbers that I've been speaking on before, were escalating in this country. And that's how I came about. And of course, there was remote working, more people were, exposed to, particularly to gender-based violence, and they were victimized more because they had to now work with the exact violators that they were trying to run away from while they were at work. So my initiative is basically online. So we have our empowerment nudges. We post nudges, and we post codes on real life issues. And I want to believe that if someone has been bullied online and then they come across our empowerment codes, they will be able to say, now my confidence has been lifted somehow, and I don't need to go about feeling bad with these emotions that someone has made me feel. So that is the first thing. The Big Sister Society Facebook page, where we encourage well-being and all-round fulfillment, and with real life codes and empowerment nudges. And then, we also encourage the block and delete button. Like if someone is doing something wrong to you, we just encourage you to right away block them, delete them out of your life, so that, your mental health, your mental environment is taken care at the end of the day. Because like we say, it's about you and you alone. We also, encourage the idea of taking a break away from Facebook. If you feel like you're being cyberbullied somehow, we mostly encourage people who've been victims, to take a break from social media. And of course, as to the innovative technologies that are in place, someone mentioned earlier on that, Apple has encryption and data protection, so which safeguard user data. And of course, I also mentioned something to do with the verification ID, where one can be able, if one is being impersonated or somehow that character is being assassinated online, they can be able to put that verification ID to say, but this is not me, or something like that, so that at the end of the day, it is verified that the person who is being impersonated is not the exact person, the violators are trying to impersonate. So I think generally that's just that about the innovative technologies that are in place. Otherwise, technology is something that keeps on progressing, and as it progresses, we need to learn forward and lean on each other. And maybe the idea of the sustainable development goals, we always say that we need to be a gender equal world. So I would say for me as a social entrepreneur, I always try to bring it to myself or to my level to say, but when you're saying justice and strong institutions, are we talking about the buildings themselves, or the UN, or these other big platforms, or perhaps are we talking about your organization, for example? Are we talking about the government? I want to believe that it should start where it should be. That is it should start with myself. Is my heart a strong institution? Do I have a pure heart towards others? I mean, if you have a pure heart and your heart is genuine, you wouldn't want to cyberbully someone. So we always encourage, this, self-reflectory moments to say, are you really that? When you're saying the world should be, united and stand for the SDGs, are you personally, doing that yourself? When you're saying the world should be, a gender-based, gender equal world by 2030, are you yourself, your actions, your perspective, your ideas, your gesture, your responses to life, are they gender equal? So that is just what we encourage. We encourage simplicity of addressing matters from where we are with what we have, with everything that we are. So that is just that. And one other thing, one social entrepreneur that I know of here is also running, a counseling app. Like they have established a counseling app. So this is whereby, people can easily get counseling through the app that, that this colleague have created. So we are really trying as social entrepreneurs, but we try as well to, solve issues and solve all the social matters from where we are with what we have. Like we just want simplicity. Thank you.
Awesome. Thank you. Very interesting conversations here. And, she made, while she was speaking, it dawned on me that chances are that people could actually cyberbully without understanding that they're actually cyberbullying. All right. So I would like that by the time Helena invites the next person to speak, she should shed a bit of light on how to gatekeep those kind of cases. You understand? So Helena, please take up from there.
All right, thank you. Thank you so much, Sengo Fatso. So it was very much insightful for the fact that, and I'm so much glad that Botswana is actually even have a Data Protection Act, which for us Namibian, we are still in the communication process of that. So it's a good thing that Africa in general is actually taking up space in terms of data protection and also actually just to protect its users, I mean digital users. So on that, I just want to move on to the work-life balance and burnout. How can we balance our work life? And I will just give this to Onaulapo. Sorry for pronouncing your name that way. So what governance approaches can organizations adopt to encourage and facilitate flexible work arrangements, such as remote work, flexible hours, and also just compressed work weeks? So maybe you can just give us a bit of what you think on that. I think you're muted, so you can just unmute and.
Okay, thank you. I can unmute. Sorry, I was struggling to unmute myself. Yeah, it just keeps telling me that the host doesn't allow to unmute. But anyway, yeah, thank you so much for your question around the governance structures that the workplace that the employer can put in place to enhance work-life balance, especially around remote working. And what I've found so far in my experience, especially from a governance standpoint, is there's a need to set clear rules and boundaries and policies and procedures across the organization. So before, so where I used to work, we had during the pandemic, just shortly after the pandemic, there was a policy around working from home, and that policy highlighted the mode of work from home, the frequency of work from home, the expectations around employees' productivity levels, timeliness, things like resumption and things like that. Are there any changes to it? What does that look like? Is it still 8 o'clock? Is it still 9 o'clock? Is it 5 p.m.? How do we handle breaks? What are our expectations around productivity? How are we looking to assess productivity as well? So I think it's very important to start off with defining, your workplace policies and ensure that it's very clear. I think it's also very important to set guidelines on collaboration. I think that most people found that during the pandemic, there was a lot of working in silos and just a certain loneliness, that you feel when you're not working at the office where you can, engage people, collaborate with people and all of that. So the guidelines also need to be very, very clear, around how the organization wants to drive collaboration. So it can be things like, are we using video call? Are we enforcing the use of video call? Are we having daily check-ins? Are line managers having daily check-ins with their team members? And this also touches a bit on mental health, because if you're having daily check-ins, you get a sense of how everyone is doing, and you get a sense of who's struggling and who is not. Are we having things like virtual happy hour, that employees can basically, let loose for, 30 minutes, 1 hour. There's a need to set all of those guidelines as well. Then as an employer of labor, I think it's also very important to ensure that the resources that are required for employees to effectively work from home, because the ultimate goal is work-life balance, right? So for employees to effectively work from home, they must have all the tools that are required. There's some that are required on the employer side, and there's some that's required on the employee side. So for example, availability of internet, does the employer need to provide a stipend towards the internet costs of the employee? But in the same vein, the employee has a duty to ensure that they have stable internet connection at home. Do they have all the required tools? Do they have a working laptop? Do they have a laptop that the camera works, the microphone works, all of those things? Do they have effective work from home stations? Are there things that the employer can do to ensure that the employee is a little bit more comfortable at home? We have in the past consider things like, supporting with solar power, supporting with the cost of a proper chair that helps with your back and your posture and all of that. there's also, once again, a need to train your line managers to ensure that they're able to effectively make decisions with regards to working from home. So empowering your line managers from a governance standpoint to ensure that they're able to make decisions. So for example, if a line manager is finding that, you know, productivity is dipping for a particular employee, are they able to withdraw the work from home privileges? Are they able to dig deeper? You know, are they able to provide a little bit more support and guide the person on how to effectively work from home? And I think that, you know, finally, I would say that the guidelines and the policies need to incentivize positive outcomes. So how are we tracking performance? Are we measuring timely completion of projects? Are we tracking increased customer satisfaction? If we're doing all of that, you know, what is in it for the employee if they're able to achieve these things? Because when you work from the office or when you work on site or, you know, wherever, you know, there are times when you're able to effectively tie in performance to for example, FaceTime. Like, you know, if it's customer satisfaction and you have people that actually approach your employees, maybe a sales role, then you know, you're able to effectively tie in performance. But if you go virtual, you know, how are we measuring that, and how are we incentivizing for the results that, you know, the organization is actually seeing? So I think those things for me are a good way to put the frameworks around work-life balance with regards to working from home, the tools that are required, just so that generally, you know, the mental health of the employee is not significantly impacted.
All right. Thank you so much. I think we can all agree that employees' well-being is so much crucial, especially in the digital world, whereby sometimes you are required to work from home. So it's important that you are equipped and you are also just aware of what exactly you're doing. So moving on to Joshua, I just want to find out what are the key components of supportive work environment and to prioritize employee well-being and promotes a healthy work lifestyle balance, as we all understand that employee relations and well-being is very important. So maybe you can just give us your insight on that.
Thank you so much, Helena. In answering this question, like Lakwa has done justice, and she's going to just help me move smoothly into this. The first thing is always about this flexibility. We know that, yeah, if people are given the opportunity to be flexible in their ways of working, it helps improve their productivity. And it's also for the organization to be able to ask themselves, what's the best way to be able to make sure that our staffs, our colleagues are actually working, and then their work-life balance is ensured. I know that there's this research that says that once people have flexibility in their work, it helps them to be able to have close to 55% more of job satisfaction. And sometimes you would even discover that people would embrace flexibility over even having a pay rise. Like, people would go to organizations that looks into their work-life balance itself rather than the ones that even pay more, because this is really very important. Another thing it's also with communication. I would want to work with an organization that communication is smooth, it's not ambiguous. I want to work with an organization that makes me feel needed. I want to work with an organization that ensures that my inputs are valid and they want to listen to me. So this is really very important in going forward. And we've seen it with the pandemic itself, opening up this space whereby colleagues, people who run the organization, HR, make everyone know that, hey, you are important to us and we want to find a way to make sure that you are more productive on the job. And another thing is also making sure that you don't overburden people with work. Sometimes you have to ask yourself, hey, is this actually on my JD? Like, am I doing too much? I've seen cases whereby companies are employing people and then the job description is just so much. So you have someone who is a communications and fundraising and partnership associate. Hey, that's doing the job of 3 people. And you want that person to be productive. So sometimes I tell people that when you're looking out for a job and you are looking for a new role, the first thing to ask yourself is, what are they hiring for? If it is too much, if they are trying to give you 3 people's work, please run away, because that organization is not thinking about work-life balance for you. They are not thinking about your mental health at all. So make sure that the working condition is easy. Make sure that when the workload is not so much for people. Another thing is supporting employees, creating programs like wellness programs to make them understand that their mental health is important. And sometimes it's not just another seminar, and it could just be this opportunity. You have this up that you can, if you work in this organization, you have access to monthly spa. I've worked with an organization that every month you can go to the spa. So it's something that I was looking forward to. You tell them that you can always take times out, you can always take break, because we want to support you. Your health is priority for us. And also encouraging colleagues to actually take time out is also very important. Taking time off from work, let them go away to refresh, come back, you find out that they are more productive. And it's always very important when you are hiring or you are looking for new roles, you are asking these questions. Am I working into an organization that respects public holiday? Am I going into an organization that knows that my weekend is my weekend? Weekend is not an extension of the weekday. So you want to put that into perspective. An organization that also ensures that stress is not so much on your part, and doing every one of these things, like prioritizing well-being of the employees, makes them even more devoted to the organization. They want to do the work. So you find them on sites from Monday to Friday, because they know that my organization prioritizes my work-life balance. And it's also a call out. I'm also using this to say that for most people, even when you want flexibility, it's not the call for you to get another job somewhere else because the organization is flexible, they are remote, and you're feeling, oh, I have a lot of competence and I can do so much. That way, you're even adding a lot of stress to you, because at the end of the day, you will not be able to deliver, and then they will start asking you questions. Are we giving too much for this individual? So flexibility, open communication, trying to make sure that you support the employees, and also making sure that time offs are encouraged, are things that would always actually encourage work-life balance. Thank you.
All right, thank you so much, Joshua, for that insight. So I believe employee relation is really critical, especially in the workplace, because employees are ambassadors for whatever organization it is. So it's important that we actually prioritize their well-being in the work environment, and also just communication. That's actually one of the key things in the workplace, because like with the digital worlds now, I remember one of the organizations that I was working for. So it's even difficult to see people, just your coworker, everybody just in their offices, and then you just communicate via email. And it's flexible, but yes, it's really mentally okay. Um, so yes, communication and communication. So I'll just Udeme, so we can just take it up.
Awesome. Thank you. Thank you so much, Joshua. Thank you, Helena. We would be taking the last round of questions. So I would like to implore our panelists to add their parting words to whatever responses we're going to get going forward, because we have already overshot our time. So I would run to Dr. Ron. I like to engage Dr. Ron because he's almost always behind the scene. Okay. So yeah, that was on a lighter note. So are there specific industries or sectors that face unique challenges in achieving work-life balance? And what tailored approaches can be implemented to address this challenge? Around, please. It looks like he's battling with his microphone. Let me see if I can.
Yeah, perfect. All right, thank you. Thank you for that question. So in terms of I mean, every industry differs, I mean, what happens in the healthcare space is different from what happens in fintech or agri-tech or uh, every space has their own peculiarities, really. So I wouldn't lump everybody into the same umbrella to say they're all facing similar challenges, right? So for example, now, I mean, there are certain cases where a doctor has to be in the hospital, right? I can't operate from home. I need to be in the theater to do my procedures. Or if we're doing fintech now, yes, you can comfortably work from home, maybe working on the back end, you just need internet and good connectivity and a good system and all of that. And Blacko had already mentioned some of the key things that organizations actually need to do to improve the whole work from home scenarios. So I would just say that I mean, every organization needs to look at what they are doing and what are the issues and how can we make things better, because what I do in the hospital is different from what you do in the bank and all of that. So that needs assessments, like Lapo said, is very, very key to understand the peculiarities of whatever space we are in and design appropriate interventions to support your staff in working from home and all of that. Like myself now, I work from home, right, most of the time, and my organization has taken the pain to say, okay, what and what do you need to be comfortable at home, because they know what I do every day and all of that. So, and they provided all the support and all of that. I think the other day they sent a survey to say, are your equipment good? Do you need to change this one? What is the condition and all of that? Have you gone for your regular checkups, your eye and all of that, because they understand all the associated risk with my job at the moment, So those are kind of things I think organizations need to be doing in terms of supporting their workforce to work effectively, really. Then at the higher level, again, I think, well, we've talked about policies, but again, at the higher level, organizations need to be mandated to do some of these things, really, because some people, it's not as if they don't know what to do, they know what to do, but because nobody is pushing them or holding them accountable, they leave staff to, probably suffer. So people say, okay, we need this, we need to tell you, no, this is not possible, even though they are making money, but they don't just want to make life easier for their staff and all of that. So at the higher level, I think governments need to, enforce some of these things to say, you need to look after your staff because they are the ones making the money for you. So you need to invest in them, in their health. I mean, if a staff is not productive, I don't see what the person is doing in the company, and my work shouldn't be so difficult that it begins to damage my health, really. So that's the way I see some of these things. And even people that work for me, to freelancers and all of that. So from time to time I check in, like I think Lapo said, incentivize data. Everything is costly these days, so you have to make allowances for some of those things. I mean, if somebody is not coming to work and you're expecting the person to deliver, then you should make provisions for that person to be able to deliver effectively on the job, so that there are no excuses to say maybe there was no light, or I ran out of MTN data, or all of those support systems actually need to be put in place for people to work effectively. I think that's what I need to say. Then in terms of parting words also, I think I'll focus more on the mental health online communities. I think each one of us has a responsibility, really, to ensure that we use the social media responsibly. We don't bully people, we don't insult people and all of that. And also tell the person next to us, I mean, if you see somebody trying to drag people or insult people online, like, hey, this is not right and all of that, you need to put yourself in those shoes. So I think we need to take that responsibility, each one of us, to start sensitizing people on, responsible use of digital media or social media. I think that way it could, cascade on a larger scale rather than waiting for the government or the national people to force it down before people start complying. Thank you.
Thank you. Thank you so much, Dr. Ron. I would like to, I've just been notified that we have some questions waiting for the panelists, and I think it would be ideal for us to take them while we're trying to wrap up the session. Helena, do you think so? Because I think we're really overshooting, so we could just take them on the roll so that the remaining panelists that have not given their parting shots can respond to the questions, and the ones that are directed to specific persons should be taken, and then we wrap up the session. I really do hope that I have the permission of the organizers to run that way. Please, Helena, please take up from here. Thank you.
All right. Thank you so much, guys, for the insightful discussion. So we are going to take a few questions from the audience. So one of the questions that actually came up is that how do we incorporate solutions that are not mainstream due to the language barriers, lack of formal education, but are unique to peculiar problems in rural areas? So maybe someone can just pick up that.
Yeah, maybe you should take the question again, Helena. You should take the question again, and then maybe Leonce, Sagofadzo, and Joshua and Lapo can attempt right away, please. Please.
Okay, so the question is, how do we incorporate solutions? Sorry. This question, okay, this question was, I think, for yesterday. So the question for today is that, could you point us to materials or pages to follow that talks about how to use social media in the right way? So I'm sorry for the previous question. I think it was for yesterday. This maybe can be answered by Dr. Ronalds for any materials or pages to follow that talks about how to use social media in the right way. Do you have any suggestions on that?
It looks like you're still having issues with unmuting. The host, please, can you help us?
All right, thank you. I think I'm fine now. So in terms of documents or resources that point towards using social media properly or effectively, I mean, there are a lot of them out there. So I can only speak for or comfortably about in the healthcare space, which is where I operate in. So incidentally, I think last year or 2 years ago, I and some colleagues put together a document, trying to say, this is how you should behave on social media. These are the risks. This is how you should post, when not to post, and all of that. And I think some of those points or actions that we raised there can also be extended to other professions, really, because it doesn't really differ that much. Things like before you post, you think about the post. I mean, why am I doing this post? When it goes out there, what was my intention of making this post out there? Is it going to hurt people? Is it going to insult people and all of that? Not being in a hurry to post. Some people are very quick. They see a trend, is one hashtag is trending. They are quick to want to jump on the trends just to feel among. Before you jump in, you need to ask yourself, is it really necessary for me to comment on this post, or should I just read and pass and all of that? For those doing threads, we say, okay, take time to do your threads, post it somewhere in a draft, read it again before you now hit the send button. Tips like that. Then for healthcare professionals, we are worried about, patient privacy, confidentiality. I think recently on social media, we've been seeing where people are exposing their patients because they have one issue or the other. You now come out and spill somebody's medical history, on social media, which is highly unethical. That's not what we are trained to do and all of that. So those are some of the things we've put in place. I'll probably share the link to that document. It's free for download for everybody. So you can probably share within the community for people to get access to that. Then I think also people might want to familiarize themselves with things like data protection acts and all those policies around data protection, confidentiality, because they exist out there. So just get yourself familiar with them, and I think that's it. I'll look for the link and share with you in a minute.
All right, thank you so much, Ronald, for that. So I'll just take two more questions because of time. So the next question will be, as a professional who is concerned about growing a social media page, how do you create a balance between taking care of your mental health and sustaining the growth of your page, considering the fact that when you get back, there's a probability that your post may no longer gain the traction it used to get before? So anybody would volunteer? I'm not sure who I can point that to.
Right, let me answer that question. It's really funny because we're in this digital age, and social proving is really the in thing now, and growing your social media page is one way to show authority. So the first thing I would say is that post and go away. That's the first thing. Post and go away. Come back maybe 2-3 hours later to see how is this post performing and learn from it. It doesn't mean that it's not you staying on your social media would not grow the likes. Yes, there are some analytics, there are some hashtags that you need to put in and all those things. But it will not bring all the people at once. So the first step is post and go away. So when you come back, you now start asking yourself, what did I do right with this post? So you check what's your highest performing post? What's the one that is not performing so well? And do a compare and contrast. What's the kind of voice you use? So it doesn't mean that you have to stay there. Sometimes for most of the work that you see people do on social media, a lot of the background work is in the strategies, the thinking, and then you deploy on social media when you come to see what you've done so far. So first, please post and go away and realize that you can even discover that most of your audience, the people that really need you so much, they are not even on that social media. And there's not so much pressure on you. With consistency, and I'm saying it from someone who has grown a page from zero or from 100 to about 50,000 in less than 3 months. It's also understanding that it's just being consistent with your posts, and with time they would come. So not so much pressure on yourself. If it's not working, also try to speak to people who you feel that they are doing it better. Like, what's the strategy you are using? It's not so different, but it's not in the amount of how long you stay on your social media post that determines how effective your numbers would be. Sometimes even staying so long, monitoring the likes, how they trickle in, how they drop on the likes, will even cause anxiety for you. So, and to be very honest with you, I had the same conversation yesterday. There was a post, it wasn't doing well, and you felt like, oh, this post should do well because of the offers. And then the post that was doing exciting was the post that I wasn't expecting to do well. So it's just asking every one of those questions and then just going away too. Yeah.
All right, thank you, Joshua, for that insight. So I'll just in 2 minutes, I would like to ask Onelapo on this question actually. So work flexibility as an HR practitioner. So how can you answer this question from the audience? So work flexibility is more common in the private sector than in government offices. So how can we encourage flexibility even in civil works for work-life balance? So maybe in 2 minutes, just give us your insight on that question.
Okay, thank you very much for that question. Yeah, so I'll take a stab at it. I know that obviously the public sector, is a little bit different from the private sector. So the allowances that most employees get in the private sector, are not necessarily the same that you can get in the public sector. But I think that, ways in which flexibility can be introduced, and this is something that I've seen done, is to start slowly, right? So for example, on Fridays, maybe the last Friday of every month, do we have the last Friday of every month as a work from home day? Just a way to ease into it and to see whether or not, it can work, and it will work. There's also ways for you to determine what roles are able to effectively work from home and the ones that aren't. And also another way in which you can introduce a bit of flexibility in the public sector is also by maybe alternating the flexibility with work from home. So for example, assuming that you have a department that's made up of 8 people, right? And, just in keeping with the theme of starting slowly, the last Friday of every month, or maybe every Friday, you have 4 people from that team work from home, and you have the other 4 in the office, so that there's still a representation, work is still ongoing, and there's no major dislocation to the activities of the day. And then the following week as well, you sort of give the other guys that didn't have the work from home day a chance to sort of chop and change. I mean, there are some roles that unfortunately, do not technically qualify. So for example, imagine a facilities manager, right? It would be more difficult for a facilities manager to have the same amount of work from home days as someone that is in tech, or is working with data, or is even working in human resources. So for example, but what can be introduced, the flexibility that can be introduced for that sort of role is to design like an administrative day, because we know that FMs, they must write their reports, they must collate their vendor payments, they must do like reconciliations and all of that. So you have like a set day, maybe every Tuesday, every Wednesday, that is an admin day for that role holder. So that day can be the day when, the individual is able to work from home and have a little bit of, enjoy a bit of the work-life balance that, his colleagues are enjoying, and also not feel like the public sector is completely missing out, from the opportunity to be well balanced.
All right, thank you so much. Thank you so much for that insightful. So we are actually getting to the end of our conversation, and I would just like to sincerely apologize to the audience. We cannot take more questions because of time, so we really apologize for that. But we will be you'll be able to be in contact with the speakers through social media and their profiles actually. So we are moving on to, we have the poll. So Uteme, you can just maybe elaborate on that. Can you take it up?
Okay, great. Thank you so much. Fantastic job, Helena. Fantastic job, panelists. Thank you. And thank you so much for spending all the time with us in this conversation. I think that before we delve into the polls, I would like to allow our panelists to take maybe 60 seconds to give their final words. You understand, 60 seconds each, so that by the time we're done with the poll, we can really just call it a close, right? If I have permission of Chukwemeka, if you agree, please nod. If you disagree, okay.
Go ahead.
So he agrees. So I think we can start from Leonce. Fantastic submissions, Mr. Leonce. Please go ahead and give your parting words, and then we go on like that. Oh, okay. Okay. Please,
yeah, I couldn't unmute myself. Again, this is really interesting. So quickly, I will share a few quotes just to help us. One will be disconnect to reconnect. So basically take time away from your screens and to reconnect with yourself and the world around you. This is something really I advise to many of my friends I know who are struggling with social media. Unplug to recharge. You can unplug the social media to recharge, to give yourself permission to step away from digital noise and focus on self-care. And then remember you're in control of your devices and not the other way around. So I think those are a few things that I tell to my friend or even my patients, but also make sure you foster genuine connections. So I sometimes see myself having 5,000 Facebook friends, but how is that genuine connections? Like many of them, I don't know them, they don't know me. Like and also Mr. Joshua just shared something very funny but also interesting. If someone doesn't like my cooking video online, but my friends and my family like my food, what really matters? What really matters? So again, thank you for inviting us, and this was really great.
Awesome. Thank you, Leonce. Let's go to Lapo. Please take your final shot. I have asked you to unmute.
Okay, yeah, thank you so much. First of all, I just want to say thank you for inviting me to speak on the panel. Thank you very much to Abigail, for meeting me and, for us, for inviting me to speak here. I do think that definitely the mental health, wellness and well-being of our employees is definitely here to stay. And I think that for employers of labor, it's something that needs to be built into the strategy, the people strategy, and also the budgets for the employee every year, because it's very important, especially now where businesses are demanding so much from their employees. There's a higher chance of burnouts and higher chances of people feeling, especially with also remote working as well, people feeling a bit left out, people feeling a bit lonely. It's very important for organizations to really focus on the mental health of their people and ensure that they have actionable strategies that are actually working, like tried and tested strategies, to ensure that they're meeting the needs of those employees. So I think that's the final word from me.
Thank you. Thank you, Lapo. So we go to Sago Fadzo for her final shorts, and then we move to Joshua and then Ronald. Thank you.
All right. I think my last word would be just as much as we take our cars for servicing every 6 months. Let's treat mental health the same. Just as much as someone would have flu and then they go to the hospital and then they get prescription from the doctor and then they get to finally fix their flu. We should not stigmatize mental health. We shouldn't treat it as an illness that says someone is mad or they're insane. We should, accept, our circumstances if we are, diagnosed with mental illnesses, and we should just find our clan online and offline. Find the people that, make you who you are and positively contribute to what you stand for as an individual. And lastly, I would like to thank Ambassador Chipimeka for this invitation and the rest of the team and everyone else. I appreciate you. I appreciate the other panelists. I've learned a lot, and I want to believe that I have found my clan today, and this conversation and the relationship and the friendship would not just stay within this, panel discussion, but it go further. So thank you so much for having us today.
Thank you. Thank you. Joshua, please.
Yeah, so my parting shots would be, first, take your breaks. And when you take those breaks, especially things that your organization have to offer, it's not an opportunity for you to start planning another party. Sometimes people you can't wait for that next break or that holiday because you want to go for one city that is far away, and then you come back and you ask yourself, what happened to me? I look more stressed than I left work. Also, you cannot be too busy not to enjoy the perks that your job gives to you. I've worked in places whereby I tell colleagues, they're like, we have spa. Why don't you go to the spa? And they're like, oh, I'm too busy. I'm like, really? And it's free. Please use it. Every opportunity that your jobs gives you to improve on your well-being, use it. I don't miss out on all those things. I use those perks very well. And please use it. And let's put our mental health into perspective. It's very important. I want to thank everyone for the organizers for inviting me. I also want to thank the speakers for making this easy. To be very honest, when I got the invitation to speak on this panel, I was like, are you guys sure that you have the right person? Because so but having been here, learning from you all has been really wonderful for me, and I hope that we get to connect even beyond this space. Thank you so much.
Thank you, Joshua Aladi. Ronald, please, let's have your final shots from behind the scenes.
All right, I'll start by saying a big thank you to the organizers of this summit. It's actually an interesting one, and I've enjoyed speaking on it as much as I've also learned from other speakers too. Kudos to the whole team behind this event. So for parting words, I would like to say our mental health is our responsibility, really. So it's not for any other person than yourself. So you need to guard it jealously and take proactive steps in protecting your mental health. And this ultimately moves into the social media space. You want to use social media responsibly so that you don't have scenarios where your mental health is impacted because of your presence on social media. And like I said before too, we owe it as a responsibility to talk to people around us on how to use social media responsibly to make the whole space conducive and okay for other users to be there without fear of being insulted or bullied and all of that. So that's what I'd like to say. Thank you.
Thank you so much, Dr. Ron. Thank you, our panelists, for spending all of this time with us. In just a few moments, we'll be done. So, but we'll quickly be going into the polls now. And I think before we go into the polls, I want to thank you, because by the time we are back, you'll be seeing Chukwemeka handling the rest of it. So thank you so much for allowing us, myself and Helena, the opportunity to host this session today. So we'll be moving straight. I think Helena would have a thank you to say, maybe after now or maybe now, please. And then we'll go into the polls right away. Helena?
Yes, well,
I've started the poll. I've started it.
the poll is actually
We can do them simultaneously.
You can started the poll now.
Yeah.
Please make sure you take it, everyone. It's just a very short 5 questions on what we have just talked about. We want to just get the audience views and feedback to help us in our data collection. Are you having issues taking the poll? Let me know. It's a very straightforward thing. You don't have to overthink it. Just go straight. You can see 6 people have taken the poll. We have more 12 people. Okay. Yeah, we have 8, we have 9. So we should wrap this in 1 minute, in another minute. So please make sure we have 10 persons now. I can see the results are already coming in. I can see the results are coming in. Okay, we have 30 seconds to go. So this has been a very interesting session, and I've learned a lot from our amazing panelists, Mr. Leon Bianyima and Joshua Alade, and also Chego Fasoko-Sintwa, Onalupo Thomas, and Dr. Ronald Kelechibe. And also, this has been an amazing section being moderated by our amazing moderators, Mr. Okono from Rio Hub and Helena Joans from Window Corp in Namibia. This session has been awesome. So I'm ending the poll now, the results. Thank you so much to everyone who has participated. We had 12 responses out of 18 persons in the room. I think that's majority. I say we have majority. So let's see the results. Can you see the results? Yeah. So we can see that more people spend over 5 hours online. You can also see that you think spending over 8 hours on screen time is safe. More persons indicated no. Do you think social media impacts your mental health? To tick yes. Have you ever taken a time off social media because of your mental health? Yes. And finally, would you rather have physical interactions or online or interactions online? And more persons take physical. So you can see that from our discussions today, everything tends towards having more or building more relationships, offline, online, but most importantly, despite all that's happening online, we have to have physical connection because that's what keeps us grounded. This really, we have achieved our mission for this session because we can see the audience feedback has validated that. Thank you again to our panelists on behalf of Global Choppers Port-Harcourt Hub and the team behind this, and also our partnering hubs, Rio Hub and Window Hub. We can really appreciate everyone that has taken time to connect. And it's streaming live on our YouTube. Next session starts by 12 p.m. and we'll be talking about bridging the digital divide. And that's also going to be an amazing session that you all will want to connect with. And we look forward to having more interactions from this process. Thank you again. I really appreciate more communications to be shared via email to our speakers subsequently, and also to our guests through our social media platforms. Thank you again on behalf of the Port-Harcourt team and the partners. I say thank you. Look forward to the next session by 12 p.m. Okay. We are going to play the ADGS video just to pass time as people log out of the call. Where technology is intertwined with governance, here comes an amazing event, the Africa Digital Governance Summit. Africa Digital Governance Summit is a program hosted by Global Shepherds Hub in collaboration with Global Shepherds Hubs in Nigeria and the Africa region.
Are you ready to embrace the future, shape policies, and revolutionize governance in the digital age? The Africa Digital Governance Summit is here to empower and unite leaders, change makers, and innovators from across the continent.
This groundbreaking summit It's an unparalleled platform where minds converge, ideas are ignited, strategies are forged from bustling metropolis to rural communities. This event serves as a catalyst for progress throughout.
The Africa Digital Governance Summit aims to accomplish 3 crucial roles. The first is to foster a deep understanding of digital governance and how technology intersects with the diverse needs and challenges faced by nations and communities.
This summit is a call to action, propelling participants to collaborate, share insights, and create actionable solutions that can shape the digital landscape of Africa. Together, we can pave the way for inclusive, transparent, and accountable government.
The importance of attending this summit cannot be overstated. It offers a unique opportunity to engage with high-level decision makers, industry experts, and thought leaders who are shaping the digital governance landscape.
Whether you're a policymaker, a tech enthusiast, an entrepreneur, or social advocate, attending the Africa Digital Governance Summit will equip you with the knowledge, connections, and inspiration needed to drive change within your sphere of influence.
So mark your calendars and join us at the Africa Digital Governance Summit, where Africa's digital future unfolds. Together we'll build a more connected, inclusive, and prosperous continent.
Visit adgs.netlify.app for more information to secure your place at this transformative event. See you there.